everyone, and welcome back to Azeem USA. Today, we're diving deep into a topic that's been making headlines and affecting lives: Lyme disease. With recent news and advancements, it's more important than ever to understand the symptoms, diagnosis, and what's being done to combat this often misunderstood illness. You might have seen the recent news about Justin Timberlake revealing his Lyme disease diagnosis. This really brings the conversation to the forefront and highlights that Lyme disease can affect anyone. It's a bacterial infection transmitted through the bite of infected ticks, and while it's been around for a while, new research and diagnostic methods are constantly emerging. Let's talk about the Lyme disease symptoms. The classic sign many people know is the bullseye rash, medically known as erythema migrans. But here's the crucial part: not everyone gets this rash, or it might not be easily visible. Early symptoms can often mimic the flu. Think fever, chills, fatigue, body aches, headache, and swollen lymph nodes. If left untreated, Lyme can spread to your joints, heart, and nervous system, leading to more severe issues like recurring arthritis, nerve pain, and even cognitive difficulties, sometimes referred to as brain fog. The CDC recently highlighted that some people experience prolonged symptoms even after antibiotic treatment. Now, for Lyme disease diagnosis, this is where things are getting interesting. Traditionally, diagnosis has relied on a combination of symptoms and a two-tiered blood test. However, there have been challenges with these tests, especially in early stages of the infection. But there's good news on the horizon. Researchers are making significant strides. For instance, Northwestern scientists have identified an antibiotic that could treat Lyme disease with a much smaller dosage. And at Johns Hopkins, studies are revealing inequities in early diagnosis and treatment, particularly for Black individuals, which is vital information for improving healthcare access and outcomes. We're also seeing advancements in diagnostic tools. The Mayo Clinic recently discussed new frontiers in Lyme disease detection, and UNC has reported on a new testing approach called the Modified Two-Tier Testing (MTTT), which is impacting how we track and report cases. These innovations aim to provide more accurate and timely diagnosis, which is critical for effective treatment and preventing long-term complications. So, what's the takeaway? Awareness is key. If you've been in tick-prone areas and experience any of these symptoms, especially flu-like symptoms or an unusual rash, don't hesitate to consult your doctor and mention the possibility of Lyme disease. Early detection and treatment are crucial for a full recovery. Thank you for tuning in to Azeem USA. If you found this information helpful, please give this video a thumbs up, share it with your friends and family, and subscribe to our channel for more insightful content. And remember, your support helps us continue to bring you these important updates. Consider buying a super thanks, super stickers, super chat, or becoming a channel member, which directly supports Azeem USA. Stay safe, stay informed, and I'll see you in the next video.